This is the TMJ. This is the seating picture because it's a synovial joint and has a disc. The disc doesn't look like that. It looks like, who rides the horse? Do you ride horses?
No, I don't.
Okay, so imagine somebody, a jockey riding a horse. Or a motorcycle wearing a helmet, big helmet. The helmet would be like the disc, and the head will be the condyle head. Every time you move your head forward, the disc will go backward. And when you move your head backward, the disc will be like that. That's the movement of the TMJ. The disc movement, it's opposite to the movement of the condyle head. And actually, the lateral pterygoid muscle, that's lateral pterygoid muscle. Actually, it's two muscles. Superior head control the disc movement, inferior head control the condyle movement. And this is the only muscle that opens the mouth. There's suprahyoid muscle that can aid in opening the mouth, but this is lateral pterygoid muscle is the controlling the movement of the mandible, and the TMJ is unique joint in the body. Why I think it's unique? It works bilaterally, work with brother synergy. They don't work by alone. That's why when you have ankylosis, even this is ankylosed, the other one doesn't work because the other one don't work. So that's why the TMJ is unique joint. So that's the articular disc, and there's multiple description about it. The mandible in general is suspended by muscle and ligament. 3 ligaments. We have Saleh-mandibular, TMJ ligament, and sphenomandibular ligament. These ligaments add in stability. But also the ligament, TMJ, this is our joint capsule, add in the chance of ankylosis. So that's why we're teaching early dentists, any dental professional, the diagnosis. If the patient comes, they couldn't open their mouth, something wrong, take x-ray, see that. The mandible is the strongest and largest bone in the face, although it's the second one to be fractured. After which one? Which bone? The most common to be fractured? Nasal. The most common to be fractured is the nasal bone. Then the mandible. The mandible is very strong, but because of unique shape, and there's a source of weakness, like long the root of the canine, wisdom tooth. Wisdom tooth, it's a vacuum wisdom tooth. It will take part of the osseous tissue or bone tissue. So that's the weakness. The condyle head, the condyle neck is also weakness. These are weakness because of particular shape of the mandible make it more vulnerable to fracture. And also mobility also can also. We're missing one process. We have ramus, this is the part of ramus, angle, condyle process, coroidal process, mandibular notch. We have one process which is very important, dentist, dental lab technician love it. Which process we're missing? Alveolar process, the process that carry the teeth. Alveolar bone. Alveolar bone is a temporary bone. When you extract the tooth, there's no function, it will shrink. That's why we have problem with complete denture people. If there's no function, alveolar process will be dying out or resolved. This is a good picture of the joint capsule ligaments. The muscle of mastication. Muscle of mastication, everybody should know about them. There are 4. Technically 8, left to right. Temporal bone, temporalis muscle here on the temporal bone. And it's like a fan shape. And we have, outside, we have a masseter. And inside, from the masseter, there's a sling. Outer side of the masseter, inside we have medial pterygoid. They become very large sling. They give very power biting force, especially in lions and hyena. They're very large. And some pictures show the masseter very strong and bigger than medial pterygoid. But from my experience, I've seen people like dentists when they do inferior alveolar injections, try numbing, sometimes they damage the medial pterygoid. And when there's infection there, the muscle gets spasmed. we call it trismus, and very difficult to open. Very strong muscle. That's the medial pterygoid. Lateral pterygoid muscle is different from the medial pterygoid. Some people they call it twins, but they are not twins because they function is different. Medial pterygoid close the mouth. Lateral pterygoid open the mouth and control the movement of the of the disc. And that's why it's very important to know about the muscle movement. Imagine masticatory system. We have 8 muscles of mastication. We have other facial muscles because when you eat, the buccinator, this one works, which is controlled by the facial nerve. We have upper lip, orbicularis oris, levator superior. These muscles control the movement of the face and chewing. What other muscle we need when we chew? Muscle of the tongue. The tongue is a very large organ. We have extrinsic muscles and extrinsic muscles. 4 extrinsic muscles, saloglossals, hypoglossals, and genoglossals. They supplied by the hypoglossal nerve. Just cranial nerve, just one for the tongue. And supply only 3 of them. The last one called pterygoids, supplied by the cranial nerve number 9 called glossopharyngeal. So all these muscles, the suprahyoid muscle of the floor of the mouth, all these muscles work in coordination when we do mastication, chewing, grinding, left to right. Imagine you chew and talk at the same time. Imagine all the vascular, all the muscular, neuromuscular connection happens that. The problem with ankylosis, all this stops. And for many years you have to recreate that.